Ebola concerns now stretch from the United States to Central America. A Carnival cruise is on hold this morning off the coast of Belize. A passenger may have handled bodily fluids from Thomas Eric Duncan. She works at the hospital in Dallas where Duncan died last week. That worker is in isolation but shows no symptoms. The United States is working to bring her home.
Meanwhile, we're getting a first look this morning at one of the latest Ebola patients. A new video shows nurse Nina Pham smiling and talking with a doctor. This happened just before her move to a federal hospital. Anna Werner is in Dallas, where health officials are trying to get ahead of Ebola spread. Anna, good morning.
Good morning. Well, health officials asked the remaining 75 healthcare workers who had contact with Duncan here to sign a legal document saying they will not go out in public and they will not use mass transit. As for the transfer of Nina Pham, hospital officials say that with so many ICU healthcare workers sidelined because of possible exposure, it was in the best interest of the hospital and Pham to move her.
I love you.
A tearful Nina Pham receives a final visit from her Dallas doctor before being discharged from Texas Health Presbyterian Hospital. Pham seemed to have her sense of humor despite her battle with the deadly Ebola virus.
Chocolate Ireland, everything. Party, Maryland.
Co-workers cheered and waved signs of support as her ambulance drove away. Pham, completely covered in a hazmat suit, boarded a plane headed for the National Institutes of Health Clinical Center in Maryland. She arrived late Thursday night. Her co-worker, 29-year-old Amber Vincent, the second nurse to be diagnosed with Ebola, made a similar trip on Wednesday. She was flown to Emory University Hospital in Atlanta. Her family released a statement thanking everyone for their support, adding she followed all of the protocols necessary when treating a patient in Dallas, and right now she's trusting in her doctors and nurses as she is now the patient. The CDC says Vincent may have been ill days before she was diagnosed. The agency is expanding its outreach to passengers who were on the flight that Vincent took from Dallas to Cleveland on Friday, October 10th. Frontier Airlines is notifying passengers on 7 flights who either flew with Amber Vincent or were on a later flight using the same plane. The airline says it is reaching out to 750 passengers in all. Brianna Aguirre has worked as a nurse at Texas Presbyterian for 3 years.
I saw a chaotic scene. It wasn't organized. It wasn't safe.
She says nurses were never trained properly to identify and treat Ebola. And she claims the hospital lacked the proper protective gear. And she saw medical waste left in open containers inside and outside treatment rooms.
The thing that upsets me the most is how my hospital, who I had so much respect for, promised to make our safety their priority. And they promised to be transparent. And they failed on their promises.
Now, overnight, the State Department said that a hospital lab supervisor who may have had contact with specimens of Ebola left on a Carnival cruise out of Galveston on October 12th. Now, the cruise line says that person is in isolation in a cabin, has shown no symptoms, and at this point is safe staying in their cabin. Nora?
Really interesting, Anna. Thank you so much.